Welcome to Break's webinar about meeting the psychological and financial needs of those suffering life-changing injuries, sponsored by CFG Law. When someone suffers a life-changing injury such as a spinal injury, limb loss or head injury, medical care and rehabilitation are always a primary concern for the individual and their support network. These psychological and financial needs will be the focus of today's webinar. Due to technical issues, we'll be running one presentation live today, delivered by Polly Herbert, a partner and head of serious injury and catastrophic injury at CFG Law. Follow-up webcasts will be circulated in October, which we will share additional information relevant to today's topic and be delivered by any other speakers. Through today's webinar and the follow-up webcasts, you'll hear from a range of experts who will work with families suffering life-changing injury, including counsellors, personal injury solicitors and charities, to explore best practice and examples of positive outcomes. A reminder that Break provides support to anyone seriously injured in a road crash through its National Road Victim Service, and you can find out more information by visiting break.org.uk. Thank you again to our sponsors CFG Law and to all of you for registering today.
Hi everybody. I wish I was in the room and saying hello to everybody in person, but I'm here. My name's Polly Herbert. I'm a solicitor. I'm a partner at CFG Law, head of catastrophic injury department as well. And personally, I've been supporting bereaved families and those victims of life-changing injuries as a result of road traffic collisions for 16, 17 years now. It's, a very privileged position to be in. Obviously those families need support during periods of crisis, and I've had the opportunity to work with Break for a number of years. I've been in with Break volunteers to help train family liaison officers within the police forces up and down England and Wales, and it's been great that we've been able to support Break. But recently CFG Law has just entered into some formal sponsorship with Break, and we appear in the bereavement pack now. So we've taken our support with Break to another level, which is great for us, and also great that Break are arranging these kind of webinars online. Even though I do hate the word webinar and I really wish I was in the room, it's great that Break have stepped up and arranged these virtual training sessions for us so we can keep the dialogue going. I think it's really difficult during periods of crisis, which we're in at the moment with the pandemic, that we don't forget that there's still a lot of people out there that require support. The world doesn't stop. Things keep on going and they require the support. So the fact that we're able to have webinars like this, get professionals together and really talk about the work that we're doing, trying to support families and enhance that service is fantastic. CFG Law, we very much believe that we are here to help those affected by injury together. That includes victims of road traffic collisions, whether or not they have a civil claim. We routinely do quite a lot of pro bono work for people. We want to make sure the people that are victims are signposted and given the support they need, regardless of whether or not there's a civil case at the end of it. And so working with Break really aligns to our purpose. CFG Law itself, we've been around for over 30 years. We're part of the Legal 500. This is a spiel I'm being asked to do now. We've recently won 2 awards for our client first service, which is really a holistic approach on how we support our clients, and my section of the webinar will talk a little bit about that and how we try and view not just the victim front and centre, but also how life-changing injuries affect the entirety of the victim's family as well. So hopefully that's a bit about us. I hope you enjoy the webinar. We've got loads of great speakers coming up, and I'm available for questions at the end. Thanks very much.
Hello, I'm Mandy Rutter. I'm a psychologist and counsellor, and I've been working in the area of supporting people after traumatic injury for about 25 years. My role has actually been as a psychologist in employee assistance programs, and my area of work really has been supporting employees when they have been involved in incidents and crashes, and when they have had really difficult and life-changing injuries. My work has been involved me supporting people after September the 11th and July the 7th bombings. I've also been involved in working with people who've been involved in construction incidents, and also those employees who've worked in banks and pubs, where they have been often had very, very extreme injuries, often by members of the public. I've also worked with the rail industry, where there have been drivers of trains who've had really difficult psychological injuries when unfortunately there's been people on the track. So a whole range of injuries that I have been involved with in relation to people. So what I'd like to talk about today is how I've done that support, but also how the workplace can really provide huge amounts of resources in order to help people who've been affected by injuries with their financial situation. And then actually part of my job, which I just want to touch on at the end, has been about ensuring that the organisation that a person has worked for responds with a sense of sensitivity and compassion to that person who's been affected. Right, so let's start with talking about people. And how I like to sort of think about this is following all sorts of the research to recognise that people involved in really difficult injuries, when we think about life-changing injuries, think about the word change and think about life-changing injury, which means the change is a process that they go through. So the change that is experiencing is absolutely, it's going to start with a shock. Gosh, what's happening to me? I can't believe this is happening. Then some sense of sort of like the feelings of sadness, of loss, of difficulty really come in after that. Then begin to ask sort of the cognitive stuff of asking questions. You know, what happened? Why me? When did this go on? And then some sense of needing understanding and integration. Again, a sort of cognitive process of understanding that. But each person has their own sense of individual recovery after a life-changing injury. And what we would look at then is, you know, that the natural sort of flow of recovery, you know, is done by helped by colleagues, helped by family, helped by friends. But actually, after a period of time, if people are still experiencing some really difficult symptoms, maybe struggling with depression to anxiety, then we look at potentially looking at a slightly more clinical diagnosis of maybe PTSD or really deep sort of depression or anxiety. So what we've got is, as each different psychological phase, we've got a response, a different sort of clinical interjection, if you like. What we experience when people have experienced shock is we want those first response, which is often from hospital, paramedics, maybe from, you know, really intense sort of family support there. But after that, people begin to have all sorts of feelings. They feel, you know, hugely angry or sad, or feeling like withdrawn. And at that time, we need to have some psychological first aid. And a lot of our research says that psychological first aid, I like to describe that as the ABC psychological first aid. So attend to basic needs with a sense of compassion. But then people sometimes might need more than that. They're beginning to be cognitively much more aware of what's happened, asking questions. And with the questions, we need to listen, we need to acknowledge, we need to educate. But then in relation to that needing some sense of understanding and integration, we need an individual trauma support, an individual tailored response to people. And that sort of individual recovery, we need to just monitor and check that that is sort of in line with what we would expect from the situation that people have been through. And then, of course, not everyone, but some people will experience ongoing symptoms, ongoing flashbacks, ongoing intrusive thoughts, maybe an ongoing sense of their mood disorder, and therefore we would potentially be looking at PTSD or some another sort of clinical issue that would really affecting their recovery. And then we're looking at CBT, maybe so cognitive behavioural therapy, EMDR, or psychotherapy, all sort of recognised through our NICE guidelines. So that sort of, it's really important to tailor our response to each individual person, but also to the timeline of their recovery. Now, when we think about helping people after traumatic injury, we need to look at some of the risk factors and some of the protective factors. And just being mindful that the backdrop that I work in is the person has been part of a workplace. So it had colleagues, had managers, had directors. So often in our risk and protective factors for people, we can think about what are the risks, that looking at the person in their context, in their environment, what are the risks that's going to make make recovery much more difficult? But what are some of the protective factors that maybe the workplace can help for the person? So some of the risk factors, if the crisis and the incident has been a long time, has been over a long period of time, has been repeated. So some people who have been involved maybe in a bank raid, what happens is that they may have been held up, they may have been held hostage, maybe for hours and hours. That's a prolonged crisis. That means that actually recovery, is sometimes takes a long time. Repeated, so time after time after time. If you've worked sometimes in a bank, you may actually have a bank raid, not just once, but twice or 3 times or 4 times over the period of your working life. If there is both physical injury and psychological injury, that takes much longer to recover. So, assault and crash, plus the sort of at that point the impact of our feelings, of our anxieties, of our worries, plus high levels of existing stress at the time of the incident really causes quite difficult recovery time. Previous ill health, so if a person has really struggled with other symptoms and other conditions, or involved in a recent significant life event, maybe someone else in their family had died, maybe they just got married, maybe they just had a baby, all sorts of significant events can really add to the risk. And then a sense of isolation. So one of the things about isolation is that people don't have their family and their friends around them. Also, in terms of the supportive network, let's have a think for a minute. In terms of isolation, people need around them to have people they can talk to, that they can value, that they can really, that remind them that they're human beings and they're not just the product of, the incident that has happened. So in terms of protective factors, supportive network of families, supportive network of colleagues, this is where the workplace comes in, asking the workplace to keep in touch. Good relationships with managers, line managers, again for line managers to keep in touch. Good physical health helps us after an incident, an understanding of resilience, an ability to articulate our emotions, plus a sense of realistic optimism that we will recover, but with support. So as we go through this, so those are some of the things we think about with the people, but what about, our managers, the colleagues, those people impacted by it? And what we try and do in a workplace that has been affected by an injury, by a crash, is that we take the groups of people that are there to support, maybe HR, line managers, senior managers, and we do a nice sort of like matrix of support. Like, how can we help, those people in the workplace look at the immediate after effects of supporting people, promoting well-being, communicating with families, mobilizing support services. And those support services might include occupational health, might include HR, might include the employee assistance program, but also, having a discussion about finances, what's available to them. Plus, of course, private healthcare if they have that. One of the things that really helps people who've been involved in really difficult incidents is to, if they've had a good relationship with their workplace, to keep in contact. How do they keep in contact when the language is difficult? People find it a struggle to talk to people who've been impacted by a life-changing event. But actually what we can do is train our line managers, HR, senior leaders to maintain contact, which has such a good impact and can be so positive for people affected. So what about the organisation? How can we encourage organisations to respond with a sense of compassion to one of their employees or a group of employees who has been impacted by such, serious trauma? Here's some best practice that it's important that we help the organisation respond immediately, respond timely, respond from a biological, so care, psychological, mind, and social community, from a biopsychosocial response. Acknowledge how difficult this has been rather than denying it, and providing some education and guidance about how to manage it. But also we need to help people understand their legal duty of care, their financial duty of care, so that actually employees who are affected by long-term changes, by the long-term trauma, feel that the place they worked thinks about them, provides them some support, and offers that connectedness. So I guess the last thing that I just want to offer you is that one of the things when we've had a life-changing injury is that the relationship that you have with your workplace can really add to your sense of recovery. And just a couple of really significant and quite emotional testimonies from people are that their workplace can help them feel like they're not just a victim, but they really have a sense of value, that their job is still there for them, that there's an optimism that they will recover and get back to the relationships that they had with people. Thank you very much.
Hi there, my name's Andy Wharton. I'm from Spinal Injuries Association. I'm part of the support network with the Spinal Injuries Association. The SIA is a national charity that's here to support everybody affected by spinal cord injury, and we do this in many ways. I'm going to start by talking about spinal cord injury and what this actually is. So the spinal cord is a thick bundle of nerves that extends from the brain to the whole of the body. This runs from the neck down the back and extends out to the whole body. And it helps us to control body movement, feel sensation and pressure, and control vital functions like breathing, blood pressure, bladder, and bowels. When the spinal cord is damaged, the communications between the brain and the body is compromised. And this often results in the loss of movement and sensation below the level of injury. As you can see on the picture on the right hand side, this is an example of levels of injury. If the neck is injured, so that's the C level, then everything below there can be affected by the injury. Moving down the spine to the back area, if an injury happens in the thoracic area, which is classed as a T area, then everything below there can be affected also. Obviously, this results in a lot of physical impact for many people. Damage to the spinal cord happens through trauma, such as accidents, trips, falls, road traffic collisions and the likes, but also can happen through illness and disease. Spinal cord injury happens in many ways, through trauma and illness and disease. The figures are 55% through trauma and 45% through illness and disease. The largest trauma factor for spinal cord injury used to be through road traffic collisions. This has now been overtaken by falls. In the last year, SIA supported 121 people who sustained their spinal cord injury through road traffic collision. And we have a great insight into how these people are affected. And we are here to offer a lot of support to these people. However, we do want to put it across now that we are here to support everybody that is affected. So if it's through trauma, illness and disease, we are here for everybody and their family and friends also. I've been asked to talk about the psychological and financial impact of spinal cord injury and traumatic injury in general. But as you can see, when spinal cord injury happens to a person, there is many aspects of that person's life that is affected. Looking at the financial impacts, however, if somebody is of working age and they can't return to the job that they had before, and then they are put on the pathway of statutory benefits, this can be really difficult for a person to overcome for many, many reasons, obviously. If it's a family member that has a child that has become spinal cord injured, then there's extra costs to think about as well. If a person is retired, then there's extra costs. These might be things surrounding getting them home, equipment, and the likes. All this has a huge psychological impact on a spinal cord injured person or their friends and family. However, we've got to look at the bigger picture. Everything here that affects a spinal cord injured person has an impact on their psychological outcome, and has a huge bearing on how they're going to move forward. As you can see, there's many things that are affected. Here are the services that SIA have to offer to help people overcome spinal cord injury and move on in life. We have many services that are useful to many people. Our support network, which I am heavily involved in, runs across the country. I work here in the Yorkshire and North East region, and our role is to support everybody affected by spinal cord injury in many ways. The support network is run by spinal cord injured people like myself. We have many volunteers and colleagues who are also spinal cord injured that can support people moving forward. The network is an association of trusted people and partners who can help people move forward as quick as possible. We have many trusted partners, from financial experts, legal experts, and care experts, and that support network is forever building and expanding. We also have a counselling service which can help people, obviously, with the psychological impact, and that's a peer-led counselling service that we have. A spinal cord injured man heads up that service, and it is a very in-demand service. We have support lines, 0800 numbers for people to get in touch with. We have our continuing healthcare support team as well. So if somebody needs continuing healthcare as they move forward in life, then we have a team to support them with that aspect. We've got nurse specialists that work for us that support people from early on in injury and throughout life, whether that's in a hospital or in a rehab setting, or when they've gone home to their own homes, and often people have to go to a care home, and they can support people, they can support the teams that are supporting the spinal injured person there as well. We also have training for anybody with interest in spinal cord injury, and that's through the SIA Academy, and we offer many different types of training. We've got a fantastic website that's full of publications and fact sheets that are very interesting to anybody with interest in spinal cord injury to help them move forward. And we also have a whole host of other services that are useful for people moving forward. Following spinal cord injury, all of these aspects of a person's life are affected. Many of these aspects of my life were affected, but through reaching out to specialist organisations and charities like the SIA, I was able to feel like I could move forward again in life. And that is what we're here to do, to help people move forward again in life after spinal cord injury, however that has occurred to them. Here are my contact details. As I said, I cover the North East and Yorkshire. We have a whole host of people who cover all over the UK. These can be found at spinal.co.uk, or you can give me a call and I can put you in touch with the local representative. Please do take a look at our website. The advice line number is there also. Here is just a snapshot of how I have moved on following my spinal cord injury, and hopefully this will show that people can live life again after injury. Everybody's life is going to be very different. This is just a snapshot of my life following injury. When my injury happened, I never thought any of these things would be possible for me, and I'm very proud to be able to have moved on in life in this manner. Many other people can do this as well. Thank you for listening to my presentation. We look forward to hearing from you.
Hi everybody, thank you very much for joining me today on the webinar. I must admit to being quite nervous today actually. It's the first time that I've ever presented a webinar, and normally when I'm doing training or presentations it's always in person. Do like to have delegates in front of me, so hi, virtually hi. I'm sorry we can't have a breakout and have a cuppa or a biscuit during the training session, but I know there's some time set aside for Q&As later, so I look forward to fielding any questions and just having a discussion really. I know the webinar topic today is looking at really focusing on how we support families after life-changing injuries, particularly focusing on the psychological and financial needs. Obviously I'm a lawyer. I've got over 15 years experience helping bereaved families, but also families that have suffered life-changing injuries as a result of road traffic collisions. And it's a real privilege to be in that position. From a lawyer's perspective, I'll talk today, but I just wanted to precursor it to say that we're all part of the same team, really. I think everybody that's on the webinar today gets drafted in to help families really at a point of crisis, and the trust that the families put in us is staggering. It's implicit right from the start, and I think we're all very privileged to be in that position of able to help them. So I hope this webinar today is useful to everybody. I will talk about the solicitor's perspective, but that's only because that's the remit I've got today. But as I say, we're all part of that team. So I want to talk to you today about building that team really. So I normally get involved with a family anytime really. They have my mobile number, and sometimes they're signposted by a flow, or they've just heard about the service that we can provide. And so it could be any time during my working day that I will get a phone call and everything stops, as it rightly should. You know, someone's reaching out in a time of need and they need help. Sometimes it can be, you know, within a few hours of the collision. That's not unheard of. Sometimes it's in the weeks after the collision when the family member's still having some acute care. Sometimes it can be months, if not a year after the collision happens. And it's a case of it has to be right for the family when they reach out for that support, but also time kind of stops then. And my focus is, what does the family need at this particular time? Generally, lawyers are instructed predominantly to pursue a litigation case, and that's very much the traditional role of a lawyer. I don't think we behave in that way anymore. Certainly CFG don't, and I know there's lots of reputable firms that are similar. Our role isn't just litigation, it isn't just pursuing a case and getting compensation at the end. It's really being an integral part of a team, helping families rebuild their lives, and for us it's all about reaching best possible outcomes. So what we do right from the start is a bit of an assessment using a clinical tool actually. It's looking at Maslow's hierarchy of needs, and any clinicians that are on the call, any kind of OTs or physiotherapists, I'm sure you're well versed with that. People that aren't, it's actually, you know, it's not rocket science, it's a very common sense approach to things. We embody it here at CFG, so anyone that starts at CFG, they're trained on it, and they're all given a little kind of stress pyramid which deals with it. But I would encourage anybody to have a look, Google it. That's Maslow's hierarchy of needs, and it takes you through what human beings need to be secure and to function. And you know, from a very basic level, it's food, water and shelter. Then it works up to things like self-esteem, self-actualisation, which is reaching their potential. So what we try and do from day one is really look at not just the client's obviously key and at the centre of things, but we look at the client's position within the family. We look at the knock-on effect of the injury, what that may have on family, friends and the greater social circle. And we look at trying to identify where those needs fit within Maslow, and we try and come up with solutions with the family about meeting those needs. So it's very much a collaborative process. So we will speak to the client and we will speak to the family from day one to try and work out really what are their acute needs at that time. And it can be overwhelming. You know, life-changing injury has occurred, and there will be things that sometimes are on our radar that aren't necessarily on the client's radar. So I can give you an example where we recently spoke to a family whose The main breadwinner, the husband, had been severely injured in an RTC. And in this road traffic collision, he was going to work. He's just kissed his daughter goodbye and newborn baby. Wife's left at home and they're waving from the window. As he's driving to work, he has a significant collision and suffers a really severe brain injury. He's in Salford Royal Hospital. We were contacted by the FLO and we were asked to go and speak to the wife, and we visited her at home. They're actually from Brazil, the family, but they have UK residents here, but the wife's mum and dad had come over from Brazil to help. And it was very clear to us as soon as we met them that with the level of injury that was happening, it probably wasn't going to be the right home for the client to be discharged to. The home was very small. There wasn't a lot of space for rehabilitation. Add the best in-laws in the world, I'm sure, but add the best in-laws living with you at home, it's not necessarily the most conducive way to start your rehabilitation. Now, we knew that sitting in the living room at the time. It's not appropriate to speak to the wife about this at that time. So what we tend to do is we will go in, we will assess the needs, and we will try and gauge when would be the appropriate time to speak about certain things on the horizon or longer term. This next slide really embodies what we do after day one, and day one we describe as the day that we first meet the client. We talk to the client and their family, and in this particular case I'm just going to call the client Brian. This is based on a real case that's ongoing at the moment. Brian was injured in a road traffic collision and he suffered a significant brain injury, again was in hospital when we were contacted. We went out to see the wife and his grown-up children just to discuss in terms of whether or not they had a case, obviously, but it was more to follow that day one principle, assessing what the family's concerns were, what worries they had or anxieties they had. And very clearly they had anxieties in relation to Brian and what Brian was going to be like after the collision and what his recovery may look like, the effect it would have on his relationships, ability to work, for example. And I don't want to minimise them and call them the standard things, but when somebody has a life-changing injury, there are significant changes of lifestyle which are very much a given. So you will be dealing with things like financial concerns, mortgage or car payments as it was in this case. There were credit card bills. They were also concerned about the home. Brian had a significant brain injury but also had some physical mobility problems as a result of his injuries that he had. So there were concerns about adaptations to her home and how that may actually be paid for, and interim payments. And for any reputable solicitor, that is, easy work to navigate, and you expect those conversations. I think where we try and make a difference is looking at some of the smaller things and paying attention to the detail. As I said before, we are in a very privileged position where people are opening up their homes at a time of crisis, and they're really looking for support. And yes, support can be given in relation to interim payments and financial needs, but it's by building a rapport with the clients and their family and understanding what is causing them concern at the moment. And in Brian's case, his wife was very, very open with us, and she described going to the hospital and sitting with him for hours during the day, helping him with his memory loss, going through the same practices day after day as instructed by the doctors. It was clear that she was exhausted and she was giving everything that she could to her husband and his recovery. She described how when she gets home, she's exhausted. Her routine is to put the kettle on and to sit in a chair in their lounge, which overlooks the back garden. And Brian himself was a very avid gardener. And when this happened, it was springtime, and in his back garden he created a little allotment as well as ornamentals as well. And Brian's wife described to us and got very upset with the fact that when she sat down with her cup of tea at the end of the day, she would look out in the garden and feel guilty. The garden wasn't being tended to. Brian's allotment was going to waste, as she described it. And she had that real sense of distress, guilt that she was letting Brian down despite everything that he was going through and despite everything that she was doing, following all of the clinician's guidance, she still didn't feel it was enough. We weren't happy with that, and one of the first things we did within the week actually of meeting Brian's wife was to instruct and fund a gardener to go round to the house, to put the allotment right, to put the ornamental part of the garden right, so that when Brian's wife came home from hospital, she could sit in that chair, she could have a cup of tea, and she didn't have that feeling of guilt anymore. And it's those little things that make such a difference. She felt that the guilt had been lifted. She was able to refocus and understand that she was actually doing everything that she possibly could for her husband. And we all know that for people who have suffered life-changing injuries, that support network around them is so key to them reaching their rehabilitation potential. So it's part of our duty, we believe, as solicitors, to look at supporting not just the client, but the family in how that they adjust from the life-changing injuries, but how we can help improve their day-to-day lives so they can offer their full support to the client on a really incredibly difficult journey. For me, the gardening example is such a simple thing that made such a massive difference to Brian's wife and his family. It really instilled in them a level of trust in us as solicitors and their legal team, that we were listening to them, we were understanding their anxieties and genuinely wanted to do all that was in our power and capability to help them. We're not doctors. We can't rewind the clock and stop this awful incident happening. We aren't part of the criminal justice system, we're civil lawyers. And so whilst traditionally we're seen as the people that sue people for money, I think the small example of gardening really goes to show that the role of a solicitor can be so much more and can really have a positive effect right from the very outset of the case. So the next slide deals with what we did. It looks at the role of the solicitor, it looks at how we work with other people, and it comes back to that multidisciplinary team. So that's known as an MDT. And the multidisciplinary team are really the core individuals that are put in place by the legal team usually, led by a case manager, and they really support the client and the family on their rehabilitation journey. And the selection of a case manager is such a tricky and delicate process. Here at CFG Law, we have in-house client support managers who are from either a clinical background or a social worker background, and they can deal with the families from day one. They can help them navigate through statutory services, advocate for them in terms of treatment and rehabilitation, which is great, and the family's supported very much from day one in that regard. So in Brian's case, for example, when they're talking about the next step with his rehabilitation, which neuro ward he might be moved to, how the family are going to visit him, what the discharge plan is, that can be incredibly overwhelming. In fact, it's not can be, it is incredibly overwhelming. So what we try and do with our client support managers is just have somebody from that clinician or social worker background that can support the family, advocate on their behalf to help them try and navigate statutory services. That's proved really helpful. However, with a significantly injured client, you need to put in a multidisciplinary team, that MDT, led by a case manager, who will be with the client for the rest of their lives, long after the solicitors have disappeared. And so the role of the solicitor is to get everybody together. We speak to the courts for the criminal process and for the civil process. We speak to charities such as Break to get support. We also deal with the press and help the families navigate that if there's particular press coverage or interest in relation to what's happened. But in Brian's case, you'll see from the slide, we also dealt with things like accommodation, overseeing his discharge. We arranged adaptations through an interim payment. In terms of the financials, again, this is, I don't want to minimise it, but it's quite standard for the solicitor to deal with things like benefits, setting up a taxi account so the family can get to and fro from hospital. We looked at mortgage payments and getting a mortgage holiday. And then our client support manager liaised with Salford Royal Hospital and the Floyd unit in terms of Brian's next move on for his rehabilitation journey. We arranged for the family to go around the Floyd unit before that discharge happened to make them comfortable so they could see where the next surroundings were. We looked at the case manager. We got a brilliant case manager involved who went in and supported the family in very early days. I think within 2 weeks of us being instructed, all of this that you're seeing on the slide happened. The case manager came involved, started looking at the right treatment providers for Brian. Now, Brian's probably not going to go back to work due to his injury, but we want to get him to the best possible case possible. We want him actively engaging in his rehabilitation. We want a strong team around him that work with Brian and his family. So the role of the solicitor is really coordinating that team and getting them in place.
Molly, thank you so much for that webinar. That was fantastic to hear and see exactly how you helped Brian and your other customers as well. And thank you also to CFG Law for sponsoring that webinar. Hopefully all of the participants got quite a bit from that, as I know I did. We're now going to move on to our Q&A session. We have a few questions in already. Just to let anybody know that is watching at the moment, you can now participate in the Q&A and type any of your questions in to the little chat function there. So I'll start off with the first question that I've got for yourself, Polly. Do you have any experience of providing scaffolding style support to the family of a victim? So, for example, supporting them so they can get to a point where you can eventually remove that support and they can go on caring for their loved one. And also, how did that go?
Yes, we have done that before for clients. It is very much depending on what the clients and the family want, and it is such a sensitive issue, particularly with life-changing injuries. You know, obviously the will and the initial response from any family member is going to be, I want to provide that care. And I want to be there to help the individual. And it's striking that balance to allow the family to feel that way, for the client to feel safe and properly supported. But also we have to be respectful that, especially with life-changing injuries, those relationships are not what they once were prior to these collisions occurring. You know, we want to try and help families get back to that relationship of husband and wife rather than husband and carer, for example. But yet, certainly in terms of building up that scaffolding support, very much we do it on a case-by-case basis and what best suits the client and the family members. But also take lots of advice from the MDT, that multidisciplinary team, because what we're trying to build is something that lasts for the rest of their lives, so it has to be adaptable.
From your perspective, is there any scope for increased joined up working between yourselves and police FLOs?
Yes, but we've always got to be minded that we don't want to do anything that would taint any criminal investigation. I've been fortunate enough, as I said previously, to work with FLOs for over 15 years, so I'm very minded in that respect. I've also seen the resources be squished and squished in terms of public funds, and I hear a lot of frustration at FLO level in terms of the quality of service that they feel that they're able to provide for families, or even being deployed in the first place to some life-changing. So for me, putting the client and the family front and centre, I would like to work collaboratively with FLOs as soon as practically possible. We do it on numerous cases that we've got going on at the moment. So just for an example, a couple of weeks ago, we attended a plea hearing at Wharton County Court, Crown Court, on the basis that we didn't know the FLO was going on holiday. A senior investigating officer may not have been able to attend. So we were there to provide some holistic support for the family. So when they got to court, they at least had a friendly face there that they knew. And I think that was really important. Logistically, we can't actually do anything at the criminal hearing apart from sit there in court. But just little things like arranging a family room for them, and making sure that family members could get in, particularly with the COVID restrictions at the moment. Exchanging information with the flow as well, so the families aren't having to repeat very difficult conversations with two different people. But also we've had some safeguarding issues that have flagged up with clients and children before. And so to make the flow aware of those safeguarding issues as well has been quite helpful. I think as long as we're respectful in terms of the criminal process, then yes, I think there's lots of scope for us to work together.
Wonderful, thank you very much. That's a great answer. And just to reiterate the care that yourselves have for your clients to make sure that their journey is as comfortable as possible. Another question, so would it be possible to share a copy of the webinar? I think this one's aimed at me, I can take this one. Would it be possible to share a copy of the webinar? It would be hugely beneficial for our team to understand a client's journey before they reach the financial elements and of course the breadth of work that a solicitor undertakes. So thank you for that. Yes, we will upload that to our Fleet Champions page a bit later and share the link to this webinar session to everyone that's currently attending. So a question over for you again, Polly. How many questions, sorry, that's not right. How many cases does CFG get instructed on a per week basis? And do you get many pediatrics?
Well, perhaps I'm not the best person to give you that figure off the top of my head. What I can say is obviously COVID has been very strange for us over the last kind of 6 months. We're certainly seeing more inquiries coming through in the last kind of 6 to 8 weeks. I would say on average we're probably having about 4 or 5 significant injury cases coming through per week. But what I would like to stress on that is not all of those inquiries lead to a civil claim. But what we are committed to do is ensuring that anyone that reaches out for us for any support or guidance, irrespective of the civil claim, they will get signposted and they will get supported by us. So routinely, we have charities such as Break, but there are also other charities we're affiliated with who are working with patients on, for example, spinal cord injury wards. They may not have civil claims. We've seen a lot of falls at home during COVID. It's that typical 70-plus-year-old man who decides to get on the ladder and look at his roof during lockdown and has unfortunately had a spinal cord injury. But through our CSMs, our client support managers, we've actually worked with them and statutory services to make sure that they're getting the proper support when they're discharged back home. So whilst we do have inquiries coming through, we are obviously committed to dealing with all kinds of inquiries to ensure that anyone affected by injury together really does get the support that they require. I think that was the first part of the question, Chris, but I must admit I've lost the second part of the question in my head, so would you mind repeating that for me, please?
Yes, absolutely. So it was how many cases do you get instructed, and the second part of that was, do you get many paediatrics?
Yes, we do get some paediatric cases coming through. We asked for, unfortunately, quite a lot of children who've been bereaved as a result of road traffic collisions, but we also asked for a few children who have had traumatic brain injuries as well. What we tend to do is keep our case volumes very low at CFG Law. We don't want our solicitors or indeed our clients to feel that they're on kind of a process hamster wheel. So we are very careful in terms of monitoring how many cases we do take in. So that's very much in the forefront of my mind. Hopefully that helps and answers the question.
I just want to retract what I said earlier around Global Fleet Champions. Absolute apologies. This video will be uploaded to our YouTube channel. Just wanted to make sure that I corrected that for the sake of being on the record. And we've just got one more question. So when will the additional content be sent to us? So I'll answer this one. I know the team at Break, we're keen to share that we've got 2 additional webcasts. We want to share those with all delegates by the end of October, and we'll send those out to the email addresses that you use to sign on, and you can easily access that again through our YouTube channel. And that's it in terms of questions for the Q&A session, Polly. I just wanted to reiterate and say thank you so much for your webinar and the Q&A session. I know that was great for myself, and I'm sure all of the delegates would also have got lots from it as well. And thank you again to CFG Law for sponsoring this webinar.